Welcome to the NCLEX review that will focus on physiological adaptation. This category will make up 7 to 13% of the PN NCLEX exam. It covers how we as nurses respond to changes in the body's normal functioning. Physiological adaptation is part of the overarching section Physiological Integrity. Physiological integrity is defined in the test plan as promotion of physical health and well-being by providing care and comfort, reducing risk potential for clients, and assisting them with the management of health alterations. Physiological adaptation involves how the body adjusts to internal and external changes. Nurses play a key role in supporting clients through these adaptations, especially when they are impaired. Whether managing acute illness, responding to trauma, or aiding recovery, your ability to recognize and act on physiologic changes is very important. Our first subsection under physiological adaptation is alterations in body systems. This is a very large subsection. It has very specific bulleted information that will help guide you with what to review in preparation for the NCLEX and items in this category. You must know signs of infection, such as elevated temperature, redness, swelling, altered mental status, and foul-smelling urine. These are early clues that the immune system is responding to a potential alteration. It is necessary to identify and report basic cardiac abnormalities. Some basic rhythms include normal sinus rhythm, bradycardia, tachycardia, atrial fibrillation, atrial flutter, premature ventricular contraction, ventricular tachycardia, and ventricular fibrillation. Nurses must know how to manage drains like chest tubes or wound drains. It's essential to know how to maintain patency, assess output, and prevent infection. Temperature regulation, both hyperthermia and hypothermia, can be life-threatening. You need to know how to use warming and cooling blankets or administer antipyretics based on the client's situation. Tracheostomy and ostomy care. Be sure to know your sterile versus clean techniques, how to assess for complications like infection or dislodgement. You must be competent in caring for ventilated patients, recognizing ventilator alarms, suctioning, and preventing ventilator-associated pneumonia. Clients on dialysis, whether peritoneal or hemodialysis, require meticulous monitoring for complications like infection, hypotension, and electrolyte imbalance. Also included in this is how to monitor for complications regarding their dialysis access. When caring for clients with increased intracranial pressure, or ICP, we must monitor for changes in level of consciousness, pupil size, and Cushing's triad. Cushing's triad includes bradycardia, hypertension, and irregular respirations. Seizure care includes safety measures, like protecting the airway, padding the bed rails, and documentation of the event. No obstetric emergencies, such as eclampsia, precipitous labor, and postpartum hemorrhage. These demand fast action to prevent maternal and fetal harm. Wound care must be done aseptically. Changing dressings, noting drainage, and documenting healing are all part of wound care. For pacing devices, know how to recognize malfunctions and monitor cardiac status. Also know post-op care after implantation of a permanent pacemaker and any precautions that the client should know about. Removing sutures or staples is a common nursing responsibility. You need to ensure the wound is healed enough for removal and follow sterile technique and correct steps. You need to know various respiratory interventions like suctioning, repositioning, or nebulizers. These are all ways to improve gas exchange. Reinforce client education on ostomy care, chronic conditions, and when to contact the provider. Also, notify the provider about any status changes and document client responses. This is essential for legal and clinical accuracy. In order to know how to address disease processes, it is important that we understand how the body system normally works when it is healthy. Once you understand the normal, then you can understand the pathophysiology, or abnormal, behind a body process and altered diseases. Nurses apply this knowledge to anticipate complications and tailor interventions. For example, knowing the process of inflammation helps you explain symptoms like swelling and warmth. Understanding cell injury and repair allows you to predict healing times and wound changes. Fluid and electrolyte imbalances can quickly become life-threatening, especially in older adults or those with kidney failure. Be sure to have a good understanding of fluid and electrolyte abnormalities so you can then provide interventions for correction. Be sure to monitor intake and output, labs, daily weights, and response to IV fluids or electrolyte replacements. NCLEX often tests your ability to recognize these imbalances from subtle cues. Nurses are first responders in life-threatening situations like cardiac arrest. You must be ready to initiate CPR, use the AED, and call the code team. Wound emergencies such as dehiscence or evisceration require covering the wound with sterile saline gauze and notifying the provider immediately. Always assess client response to emergency care and advocate for treatment changes if the client is deteriorating. Reinforce to clients what interventions are being done and why. This helps build trust and reduces fear. Nurses are the eyes and ears for detecting negative therapy outcomes, things like IV infiltration, new bleeding, or allergic reactions. If something doesn't seem right, speak up and intervene. Document all unexpected events and how the client responded to your interventions. Prevent long-term harm by recognizing issues early and supporting recovery. Now let's walk through a case study where we can apply principles of physiological adaptation. Here we have the nurse caring for a 58-year-old client who is 3 days post-operative from an open cholecystectomy. Please take a picture of this slide for referencing on the following slides. The first item of a case study will always be recognizing cues. This follows the clinical judgment measurement model. In this item, we see we need to click to highlight the findings that require immediate follow-up by the nurse. This is what we call a highlight text item. Pause the recording and determine your answers before moving on. Let's review the answers. Here we must look for things such as abnormal vitals, unexpected drainage, new pain, or signs of respiratory compromise. It is important that we think about what changes have happened from baseline. What could indicate infection, bleeding, or impaired oxygenation? Here we see with our vital signs that we have an elevated temp, an elevated respiratory rate, and an oxygen saturation that is not good on oxygen at 2 liters per nasal cannula. For our respiratory assessment, we see that breath sounds are diminished, we have crackles in the right lower lobe, and we have a productive cough with yellow sputum, all things that are abnormal findings. For activity, the client refuses to ambulate due to fatigue, again, an abnormal finding. Our surgical site looks good, it's clean, has no signs of infection, and pain is moderate at 5 out of 10 and increases with coughing or movement. Our next step in the clinical judgment measurement model is to analyze cues. So now that you've identified the findings, we have to determine what they mean. In this question, we are going to take each clinical finding and click to specify the interpretation of the finding. You may pause the recording and determine your answers before moving on. While analyzing each clue, we must use pathophysiology knowledge to determine what is going on. So looking at an oxygen saturation of 88% on 2 liters of nasal cannula would indicate that we have some hypoxia happening with our patient. Atelectasis would be determined on an X-ray, and shortness of breath would not necessarily be determined by a low oxygen saturation. A patient can have a low O2 sat without being short of breath. Next, we look at the yellow sputum. Again, yellow sputum does not indicate atelectasis. That would be identified on a chest X-ray. Yellow sputum also does not indicate ineffective airway clearance. It actually indicates that our client is having good airway clearance. Therefore, yellow sputum can indicate infection. Diminished breath sounds. This can be a sign leading to atelectasis. Atelectasis, again, must also be confirmed on a chest X-ray. Diminished breath sounds does not indicate hypoxia or ineffective pain management. Step 3 of the clinical judgment measurement model is prioritizing hypotheses. Here we must ask ourselves which concerns are most urgent. In this particular question, we are asked to identify priority concerns based on the client's current condition. This is a select all that apply item. You may pause the recording while you determine your answers before moving on. For priority items, it is a good idea to rely on your ABC testing strategy, airway, breathing, and circulation, as well as Maslow's hierarchy of needs. Both will help you to prioritize from the list of options in the item. This question tests your ability to sift through data and choose the most important or immediate threats to life. Here, using those principles, we see that impaired gas exchange, ineffective airway clearance, and activity intolerance would all be priority concerns out of the ones that are listed. We have nothing in the client's data to support surgical site infection, constipation, or risk for fluid volume overload. The next step in the clinical judgment model is to generate solutions. Here we must ask ourselves what actions will help with the problems that we have identified. Here we must complete the following sentence by choosing from the list of options. You need to decide what will help to improve the client's oxygenation and what things will reduce the risk of pneumonia. You may pause the recording to determine your answers. Let's look at the answers. The first sentence says to improve the client's oxygenation, the nurse should. We have 3 choices to choose from. Apply a simple face mask, increase O2 per protocol, or position in a semi-Fowlers. The answer is to increase the O2 per protocol. Applying a simple face mask may not be enough or may not be appropriate to improve the client's oxygenation. Positioning in a semi-Fowlers position also is not elevating the head of the bed enough in order to promote adequate oxygenation. Therefore, increasing the O2 per protocol is the correct option. To reduce the risk of pneumonia, the nurse will encourage blank and manage pain with blank. So first we will encourage either bed rest, incentive spirometry, or continuous pulse oximetry. We need to pick the option that's going to be most effective for reducing the risk of pneumonia. The only correct option here is incentive spirometry. Incentive spirometry will help to expand the lungs and help with promotion of moving mucus out of the airways and promoting airway clearance. Bed rest will minimize that movement, and continuous pulse oximetry does not contribute anything to the effective airway clearance of the client. The second part, managing pain, we have options of warm compresses, PRN opioid medication, or a non-opioid analgesic before activity. To manage pain and to help improve mobility in our client, which will ultimately help with movement of respiratory secretions, giving a non-opioid analgesic before activity is most appropriate. Administering an opioid analgesic could suppress respirations and therefore inhibit airway clearance. Warm compresses also will not do anything to help to manage the pain. That will help maybe locally, but is not necessarily indicated for a surgical patient and or for an incision. Step 5 of the clinical judgment measurement model is take action. Here we have where the nurse is preparing to implement nursing interventions. This is an order of operations item. Here we must place the nursing interventions in the correct order of priority by dragging the options on the left to the order of priority on the right. Please take a moment to review the options and place your answers in the correct order. In this item, NCLEX is testing your ability to organize, act decisively, and prioritize based on what will have the greatest and fastest impact on outcomes. Let's look at our nursing interventions in the correct order of priority. First, we must increase oxygen per standing order. This helps to decrease hypoxia and improve oxygen saturation levels. Next, we'll reassess respiratory rate and O2 levels. It's important to assess that the increase in delivery of oxygen is working and that the saturation levels are increasing while maintaining a normal respiratory rate. Next, we will encourage use of incentive spirometer. This will expand the lungs to help with oxygen exchange that will then be delivered to the rest of the body. It will also assist with mobility of secretions to prevent pneumonia. Next, we will medicate for pain prior to mobility. For surgical clients to maintain physical activity and good expansion of the lungs, they must have good pain control. Providing pain medication about 30 minutes prior to activity will help the client with completing ambulation activities. Assist the client with ambulation in the hallway. The last thing that we will do will ambulate. Once we have worked on good oxygenation, lung expansion, and pain control, you can now effectively ambulate the client. Doing these steps in this order will ensure that we have followed the ABCs in Maslow's hierarchy of needs. It would not be effective to ambulate the client first without making sure they have adequate breathing and oxygenation. The last step in the clinical judgment measurement model is to evaluate outcomes. Here we must determine which findings show that our nursing interventions have worked. This question reads, which 3 client findings indicate that the nursing interventions have been effective? This is what we call a select N. It is similar to a select all that apply, but they have specifically told you that only 3 answer options need to be selected. So let's look at the correct answer options. Again, the item asks for us to pick 3 of the following client findings that indicate our nursing interventions have been effective. The correct answers are an oxygen saturation level of 94% on 2 liters of nasal cannula, ambulate 100 feet with minimal assistance, and breath sounds clear in all lobes. Each of these indicate an increase or an effectiveness of our nursing interventions. Originally, our oxygen saturation level was 88% on 2 liters of nasal cannula. This is an improvement. Originally, our client was unable to ambulate without becoming fatigued. Now they are able to ambulate 100 feet with minimal assistance. This is an improvement. Breath sounds are clear in all lobes. Originally, breath sounds were diminished and we had some crackles. This indicates an increase or an effectiveness of our nursing actions. Pain at 5 out of 10, productive cough with green sputum, or a temperature of 101.2 all indicate client findings that are the same or have worsened. Remember, in evaluating outcomes, we are looking for things that show improvement in our client conditions. Thanks for joining this session. You now have a solid grasp of physiological adaptation for the NCLEX. Please reach out if you have any questions or need resources. Let's help you succeed because safe, compassionate nursing starts with mastering the basics.